Well, let me tell you, I have not always been so spiritual. As I was in my early days, it was more about myself. And in the last 10 years, I would say, I've started to look for that spirituality, because even though I had accomplished a lot in my life, I didn't feel complete. And a series of incidents that we might mention later led to me seeking a higher power. I was born in Dominican Republic in a private clinic. In Dominican Republic, hospitals are reserved for people that don't have insurance, or that are not as financially able to pay. In Dominican Republic, private clinics are set up for people that can't pay for those services. Dominican Republic has improved a lot. Even the hospitals, I mean, they're very well equipped now. Back when I was born, 60 plus years ago, we won't say exactly, the hospitals were not a good thing. They lacked equipment, it was understaffed. So that's why, it was primarily for the people that did not have the ability to pay. They were, government funded. How I became interested originally in medicine was not because of money. I distinctly remember probably 7 or 8 years old when I heard a conversation from my mother and my aunts. They were talking, and they were conversing, and they related that someone they knew died in childbirth in the countryside. I'm originally from Dominican Republic. I was born in Dominican Republic and lived there until age 10. I heard the conversation that this woman died during childbirth in the countryside, and there was no access to a doctor at the time when the problem arrived and the woman died. And that hit a nerve for me at that early age. And at that point that I said, I'd like to do something to help women. So the reason I became a doctor was to be a gynecologist. Or I already knew that I wanted to work with women in medicine before I even knew that you needed to be a doctor to do that. It was out of that need that I started to have that dream. Later on, I did develop a liking for the biology and all that science. So if I didn't have that, then obviously those two, the dream and the fact, wouldn't be able to go together. But it was that early. So I would say that no, money was not the number one factor. I've enjoyed the financial benefits of being a professional, and not only being a professional, but having done well. I thank God for that, because for a girl of 7 or 8 year old Dominican girl to arrive to the United States and be able to go to Dartmouth and then be able to be professor at Columbia University, it's a big deal. Dad, Carlos Jenyons, and Mom, Maria Jenyons. We call her Kating. Both born in Dominican Republic. Dad was born of, the reason I have the name Jenyons, which is actually an English name, my grandfather on my father's side was an accountant in St. Kitts, and he went to Dominican Republic in the early 1900s. At the time when there was a lot of work with sugar cane, he went there with his employer to exploit that business, and he ended up staying. He liked it so much, and he befriended a group of people that were from Nevis or St. Kitts, and one of his friends wanted to match him with his sister, who lived in Nevis. My grandfather went to Nevis, met his sister, and brought her to Dominican Republic, and they got married. And they started a family in Dominican Republic. I know a little bit less about my mom, but Her family, her parents were from an area in the Dominican Republic called Moca, also migrated to the capital city, Santo Domingo, and that's where my mom was born. I don't think neither of my parents finished high school. Dad probably 8th grade. Dad was very good with numbers. Very good with numbers because my grandfather was very good with numbers. But, these are things that you learn just, from as you go, not because you actually went to school. So I think both of them maybe 8th grade, 6th grade. Mom never worked in the Dominican Republic. She was a stay-home mom. And Dad always worked in the hotel industry. Dad spoke English. So he was and Dad was very charming. Dad had a beautiful personality. He would walk in the room and everyone would feel good. It doesn't matter what was wrong with you, he will find something good. Being in the hotel industry, he did many different jobs, mostly things that they felt that the tourists, would enjoy. He translated. He did various jobs in the Dominican Republic. When they migrated here in 1962, Dad worked in the hotel industry again, and Mom took a job in a factory because in the United States, they had to make ends meet. It required 2 incomes, and they wanted to bring my sister and I to the United States, which we came a year later. They saved, and they both worked. We stayed with an aunt. It's the first time we separated from our parents, and that was a bit traumatic. But thank God it was less than a year. It was probably like 11 months. That was very common. Sometimes, the whole family would get their visas, their residencies, and they could all come at the same time. But in our case, that wasn't the case. They allowed Mom and Dad to come and be able to demonstrate that they could, request us. In my parents' case, a sister of my mom's sister requested her to come, and she requested from my father and us to come. I don't know exactly why the embassy agreed that Dad and Mom could come and then not the children. I would suppose that maybe they needed to see that they would be able to produce the income to support the 2 children. I have a sister, and I have an older sister on my dad's side, but we didn't grow up together. We did not live in the same household. But my younger sister, Yvette, we lived together. I love school. I love learning. It was not anything that I was sad about. I remember vaguely, not distinctly, but I do remember a teacher that I had early on that was very motivating to me. As a matter of fact, when I started school, he wanted them to, instead of first grade, he wanted them to put me in 3rd grade. He said, she's 3rd grade quality. And he was very upset when they did not. So I love school. And once I arrived to the United States, I came with the same passion. I love to study. I was very enthusiastic. I loved the idea of coming to the United States. I was not worried. I was not scared. I loved the idea of a new opportunity. And early on, I have to say, I was very fortunate. I remember distinctly one teacher, Miss Littman. In those days, there was no bilingual classes or anything like that. You were put in the class and you had to learn the language because that's all there was, English. There was no Spanish class or English. It was all English. So I remember Mrs. Littman, she took a liking to me, and she would set time aside for me individually to learn. This was PS 165. This was in Manhattan. And I distinctly remember her taking time to teach me the English language. Within 6 months, I was already integrated and doing all the classes with everyone else, which is what I encourage. I think that for bilingual classes, I think delays the integration of the student. That's my opinion, just based on my own personal experience. The quicker you get in there, the quicker you're going to be learning, because otherwise you're not going to be able to integrate with the rest of the class. Now, it's very interesting because in math, I was teaching everybody else. because numbers are numbers. So I didn't need the language. From the very beginning, I was teaching everybody else in math, and I was getting A's in math. So much so that the teacher even asked me to tutor some of the students. The problem with bullying did not start yesterday. There's been bullying all along, you know? I remember distinctly within the first 6 months of being here. We arrived in the summer, and I remember early winter, there was a party in the school, and I walked into the party with the best dress that I thought was appropriate. And it turned out to be a white dress with a lot of ruffles, basically a summer dress. I didn't know any better. I'd never experienced winter before. And I remember being the laughing stock of all the girls. Because in those days, I know this has changed a little bit over time, and now you can wear off-white. But in those days, you didn't wear white ruffled dress in the winter. Not because of how smart you were, but more because you weren't part of the crowd. You know, you weren't part of the group. You know, everybody clings a different group. And I remember the girls teasing me for a long time. And you know what Mrs. Lippman did? She was so smart. I credit her with a lot of my success. She's one of the teachers that I credit. I have several. One of those girls that was teasing me a lot had problems with math. She was about to fail her math class. And Mrs. Lippman put me to be her tutor. And I tutored her. She passed her math. And we were the best of friends after that. You know, but I remember having best friends, but people that you related to that wanted to study and that had, you know, similar goals. So I do remember that. The junior high school was right across from my home. We lived on Columbus Avenue, 108th Street, Booker T, Washington. My dad had a philosophy, though. He would speak to us in English very little because he said when we arrived to the United States, he wanted to make sure that we never forgot our original language. He said, you don't want to come to the United States and learn English and then forget your own language. So at home, we primarily spoke Spanish. I always loved to dance. As a matter of fact, I remember, and I'm also reminded by my parents and the family, that whenever we would get together, I would dance and people would just sit around to watch me dance. Well, my parents worked all week. They really planned this very well. My dad worked at night. Okay, so he was home during the day. So when he arrived home, let's say 7 o'clock, he would take us to school. Then he would sleep, and then he'd be home when we got home from school. He would go to work, and my mom would arrive. During the week, we really didn't socialize too much. There was, you know, work to be done. But on the weekends, we often participated with family. It was all family and close friends that we had. So we would get together on one family's home or one friend's home, or they would come to our home. We were very social, I would say. My parents were very social. It would be cooking, the kids playing, you know. So that's basically what we did. We generally ate Dominican food. I mean, you know, we can make it, but during the holidays, two things that come to mind that was like sent from heaven because we did not have so much access to this in the Dominican Republic. Apples. Then, you know, very common tradition during Christmas to have apples on the table and to have gummy candy. And that was a luxury there. But here you could have it, you know, freely. And that was a lot of fun. I love science. I've always loved science and math. Those are the two main subjects. Now, in junior high school, I had a teacher who motivated me to like English as a language, you know, grammar and all that. But that was not one of my favorite subjects. Her name was Sita Monga, Mrs. Monga. She was from India. She's since passed away. She's a teacher that I credit for my success as well. She motivated me to see the English language in a different way, but it was not originally one of my favorites. In junior high school, we studied, but again, I love socializing with my family and my friends, but it was always a very knit group. We were not allowed to go out unsupervised. In those days, you went to school, you came home, as you said, maybe watch some television and do some homework and do some chores, but we were not allowed to go unsupervised and play with friends. No, that was not allowed at all. My first job was working at Woolworth. I started working at the age of 15. Woolworth was like a chain store, like 5 and 10 now, like Walmart now. And I remember stacking shelves at the early age of 15. I worked in Woolworth for a couple of years. When I was probably 16 and a half or 17, we moved to Queens. Now, when we moved to Queens, I did not work because it was towards the end of high school now. I attended Mabel Dean Bacon High School, where I majored in nursing. Mabel Dean Bacon was a vocational high school, and they had different vocations: business, dentistry, and nursing was one of them, and cosmetology. When I graduated from high school, I was a licensed practical nurse. During college, I worked as a nurse on the weekend and in the summers. In Booker T. Washington in middle school, I mentioned Miss Monga, which was my English teacher, and she was very motivating. She was a very, very good role model for me. But I also should tell you that there were some teachers that were not so positive. Whenever I would say that my goal was to become a doctor, there was a lot of negatives. That's very difficult. You sure that's what you want to do? Do you know what it takes to be a doctor? It requires a lot of money. It requires a lot of work. My dad was he was motivating in one way, but complacent in others. And I don't know whether it has to be with the fact that he couldn't see, he put limitations, but he also said, it's very difficult to be a doctor. Why don't you become a nurse instead? And see if you like it, and see if you can, like a stepping stone. And that's why I ended up in Mabel and in the vocational high school that I attended. Mom also, you remember, you can only encourage people to do what you can see, They didn't think that was possible. It was something that people here in America would say, it's not so easy to be a doctor. They questioned it. So she did too, but like I said, they always were very open, if that's what you want, then you go for it. But it was more as a protection, I think, like something that I could fall back on in case that didn't work. So in a way, it was good. I never lost my dream. I never lost my focus. And I look back at that and I want to challenge, I say, teachers have to be very careful because you can be so influential with your students, either in a positive or a negative way. I experienced both from teachers, but I really feel that it's very important to be careful how you set up your students. Don't put limits on your student. I should say in high school, the teachers were very motivating. I remember another teacher then, Mrs. Daniels, who was wonderful to me. She was a phys ed teacher, but she was also a cosmetology teacher. But the way I got to know her is through phys ed. I was really good in basketball. So I befriended her and again, motivating. You could do it. And another teacher that was in nursing, she was actually the director of nursing, Mrs. D'Ambrosio, was also very motivating. Both of these teachers took a liking to me. I would invite me to their homes. Mrs. D'Ambrosio had a summer home upstate, as a matter of fact, and invited a group of the girls to her home. That was a lot of support there in high school, I felt. The route that I was guided to was the vocational high school. A couple of subjects that I was not that good at. I tell you which ones I was good, but I have to tell you which one. History was not. History and geography. I don't know what happened to me. I don't think I skipped any classes because I was not part of me. But I think I must have tuned them off. We were a family-centered, but yes, we would go to the movie, but it would be with family. We were not, my parents did not let us go and visit friends by ourselves. That was not part of it. Around age 17, in my last year of high school, we moved to Queens. My parents were able to save up enough funds to make a deposit, and they bought a small home in Queens, in Richmond Hill. So my last year of high school, I commuted from Queens to Lower Manhattan, and it was time now to apply for college. It was just natural to go to Queens College because it was right near where I lived. And it was a good school for pre-med. And I majored in pre-med biology. I don't recall it being that difficult of a decision. I think it was more the school that was good in pre-med biology and that had proximity to our home. Because every day I commuted to school. I never took any interruption in my study. I tell you, the first 6 months in college were a little challenging because since I went to a vocational high school, the academics are not as strong. They were good for the high school that I went to, and I got good grades, but I had some deficiency in some classes that I had to make up in the first semester of college, especially to enter the pre-med bio. So those first 6 months were a little bit challenging, but I did it. I'm working nursing on weekends and during the summer to earn some income. It definitely confirmed that medicine is for me. I do think that was a positive that I did that. Not only could I contribute and help my parents financially, my books, my after-school activities, but it definitely solidified for me that medicine was for me. Everybody's different, and we all learn in different ways. For me, the time was very important. Maybe it took me a little longer than someone else, but I knew myself. I knew that that's what I needed to do. For example, reading something took me a little longer than for most of my colleagues, and I knew that. So I have to give myself more time. If I wanted to get the A, I needed to give myself more time. You have to find time to study by yourself, but then also study with group. I found that very, very helpful. And that's something that I had not acquired up until medical school, studying with a group. And I found that very helpful. I always say, show up, because nowadays, there are a lot of students that don't even go to class. They just have the curriculum and they just do it on their own. I don't think that is the best student. I think the best student is one that shows up. Actually, even before you show up, you have a curriculum. Read the curriculum. You know what's going to be taught that day. If you could read it ahead of time, then when you show up to the class, you can absorb it better because you already have seen the topic once. Show up to the class, do the assignment, okay? And then those are the best students, not the one that, shows up now and then, or the one that doesn't do the assignment. It's the one that does all those three things. I wanted to be a gynecologist, never lost focus on that. I befriended 2 friends in college that I am grateful for having met because, they helped me during those times. They both became doctors too. As a matter of fact, one of them, Clara Escudero, Dominican family. And she actually was the bridesmaid, was one of my bridesmaids on my wedding. And the second person was Sharon Hinkson. Also, she became a psychiatrist. She was ahead of me 1 year in Queens College. And it was because of Sharon that I ended up going to Dartmouth, because Sharon went to Dartmouth. And I had not even heard of Dartmouth until then. At that time, Dartmouth was a 3-year medical school, which was unheard of. There were very few 3-year medical schools. Most of the medical schools are 4 years. So that was very attractive to me that I could finish one year earlier. and that I had a friend, at least, I had at least one friend as I started. I did get some loans, but I also had scholarships. I had some very good, I would say probably the ratio was probably 60-40, but loans, no, my parents did not have money to help me in that. I had to take my own loan, pay them off as I started my residency and started to earn money. In those days, the interest rate was very, very low. I do remember that. They were very low. So I would say probably I was finished paying them maybe by my second, I would say 6 years probably, 6 years. The 4 years of residency, and then within the first 2 years of my medical career, I remember that they were already paid. I was happy and scared, happy and scared at the same time. Well, I was gonna leave my family for the first time. For the first time, like I said, at Queens College, commuting every day, that was not so difficult. I could come home, my parents would be there, my sister would be there, my food would be there. But at Dartmouth, it was the first time, and you go into New England, it was very challenging. I mean, I heard a lot of, bright students are there, and you start to wonder, am I gonna measure up? But that was what's so good about having Sharon there, because she was like my big sister, she guided me, and that was very positive. Also, the weather, New England, lots of snow. Everybody skis, I never learned to ski, by the way. But all of those things were very, they were a little bit scaring for me. But I adapted. Dartmouth is a small school, so that was fortunate. While I was there, I also befriended a couple of teachers that were wonderful. I distinctly remember Dr. Padilla. He was a pathology professor, originally from Spain, and he and his wife took a liking to me, and I would visit. They understood that I wasn't in that Latino culture, so they would invite me to their home and cook some meals for me. So that was a lot of fun. I was scared because it was a new experience, and I had not, I didn't know what to expect. In elementary school, I would say what I recall, probably 30% Latino and maybe 40% African American, and maybe a very small number of whites, much less in those days. It was mostly, whites. I would say maybe 10% African American, and maybe even less than that, Latino. Well, in my class, only 2. In my year, 2. Myself and another woman that was Mexican American, and about maybe 5 African American. The rest were white. In my graduating class, I was only one of 2 Latinos that graduated from medical school, from Dartmouth. I was warned that to be careful, that I may experience some culture shock, and that how the students might treat me. But I have to say, I don't think I ever felt that. Not in medical school. I did not feel that at all. In terms of the group that my circle of friends was a small group again. The first year I lived in a dorm in medical school. Actually, probably not even a full year, probably the first 6 months. And then we moved to, they had homes with students, maybe 10 students, 6 students in each of the homes, and we share those homes. And that was a better fit for me because it was more homey-like, as opposed to a room where you just, did everything there in one room and studied there. The home setup was much better, a setup that I liked. So you befriended those friends, and although it was a mixed culture in the sense that there were students from the 4th year, 3rd year, but then and that was good because students that were before you, would advise, would give you some advice. You would take some of their advice in terms of study habits. But within your own class, we always had like a group of maybe 4 or 5 students that we would study together, share information, together. And that helped me a lot to get like into a study group type of situation, which I never had in college. I always studied alone in college. And because we commuted, there wasn't that camaraderie. But at Dartmouth is when I first experienced that camaraderie between students, and that was very positive for me. That helped me tremendously. I found the regimen of medicine very, very intense. I wouldn't say that I have pet peeves. Again, I'm not sure that I can really relate to that word, pet peeves, but it was very challenging. I had to definitely study a lot, many hours. And for me, going to Dartmouth was the first time that I was actually away from home, because I started at Queens College, which was local to where I lived. So I would go home every day. So this was the first time that I was actually living on campus. And I found it very challenging, very, very challenging. I was determined to make it happen. So I had to deprive myself of a lot of social activities, where I saw some of my colleagues, on weekends going partying and going skiing. That was a luxury for me. I would say out of 24 hours, I probably studied a good 16. I probably would get 6 to 7 hours of sleep when it was not exam time. During exam time, it would be much less. I got to learn how to, cook New England stuff like macaroni and cheese. That's where I first learned that, which later I learned that is not New England at all. But that's when I first experienced non-Dominican food. And it was good for me. I influenced the other students too. They love for me to cook chicken and rice, arroz con pollo. I used to cook that. I learned to make apple pie. I never knew that it existed, but then I learned to like it. There were some other dishes from New England that I really liked and learned. Like I said, I went to Dartmouth at the time that I attended it. It was a 3-year course. So that means that with the workload of 4 years, you complete in 3 years. That means your summers are much shorter. There's no 2 months of summer. We probably had maybe 3 weeks in the summer off. And it was more intense. The first year and a half is basic science. It's all like biology, biochemistry, all that elementary work. Into the second and beginning of third year, you're doing more clinicals. You're learning more clinical medicine, which is what you really are going to be doing when you graduate. And then at the very end of your last year, you actually do different rotations where you go to the hospital and rotate through the different departments. Even, you go through obstetrics, learn how to deliver babies, and you go through medicine, you go through the ER, you do pathology, all those clinical subjects. And then you graduate. I don't recall anyone dropping off because of finances, but basically, if you didn't make the grade, you can continue. And it was mostly in the first year. I distinctly remember 2 students that didn't make it. I loved all the biology. All the biology, I just loved that. Biochemistry was hard, but I did well, but it required more study. I had an uncle, he passed already, Tío Blanco. He was the person that we stayed when my parents came to the United States. We lived with him and his wife for a year. So Tío Blanco, again, not an educated man in terms of schooling, but very educated on his own right. I remember when I was studying in college, and I was doing biology, I would take home a pig to dissect the pig, to learn the organs and to learn the anatomy. And the The one person that helped me a lot with that was Tio Blanco, because he knew all the organs, because apparently in Dominican Republic, he worked the farm. He knew a little bit of veterinary. We would dissect together the pig, and he knew the kidneys, and he knew the organs, and what connected to what. And he was very helpful to me, and we had a lot of fun, Tio Blanco and I. I would say this for any young person, but more specifically for Latinas, because this is not something that is naturally encouraged, okay? I would say the earlier you are clear of what you would like to do, the better it would be for you, because I think that that's what helped me, that I was clear very early on, that this is what I wanted. Because then when you're clear, and people start to try to put darts into that dream, it doesn't go away, because you're very clear that that's what you want. If you enter high school, you enter college, and you don't know what you want yet, it becomes more difficult. It becomes a lot easier to move away from that possibility. So I would encourage that first, be clear as early as you can. I know that not for everyone is it going to be at age 7 or 8, but the earlier you can be clear what you want, I think it's going to be more likely that you'll accomplish it. I think it does make a difference which school you go to, but more important than the school, I think, is what you do with it. Okay? I think is what you do with it. But the school, going to a good school does give you the background. It does give you the base from where you can go, and also opens doors. The fact that I definitely think that having gone to a good school opened doors for me. So absolutely, don't shy away from going to a good school if you can do it, because I think it's important. I think it does help you, but I also can tell you that I know people that go to good schools and then do nothing with it. So it's what you do with it, the passion that you bring with it. The challenge for me in medical school was more cultural than anything else, because it was the first time that I was away from home. The environment was different. Maybe more than experience it from them, maybe I felt a little bit less of, because up to, Dartmouth was said to me to be, obviously it's an Ivy League school, and some of the best students go there from the best families, culturally wise and academic wise. So maybe I felt a little bit intimidated at first, but I don't think that anyone made me feel that way. That was always on my mind, that I am a minority and I am different, and my calling, I'm going to go back to my community and serve there, So I knew that I was not going to stay in New England. I wanted to go back, and as a matter of fact, the residency that I chose was in my community. I went back and did my medical residency specialty at St. Luke's Roosevelt, which was 114th Street and Amsterdam Avenue. It's a match program. You have to apply, and that was my number one. Because I wanted to come back to my community. I wanted to come back home. I remember applying to many New York hospitals, and I was able to get my number one, thank God, When you're in medical school, you're going through testing as well. And based on the grades that you did in medical school, the recommendations of all your clinicals, during medical school, you go through different hospitals, different rotations to learn the different fields, and you get evaluated. So based on the evaluations during medical school, that hospital director, that department director may want you or may not want you. So, and then you interview. You have to go through a personal interview, and then they match you. They for example, there's a match score where I rank them number one, but they may not rank me number one. They may say, no, we don't want her. They may put me number 10. It's 4 years total. The first year is called an internship, because the first year, for example, I was accepted to OBGYN, obstetrics and gynecology. But the first year is a rotational internship, meaning as a gynecologist, I need to know about medicine in general. I need to know how to handle emergency situations, so I have to rotate to the emergency room. I have to know a little bit of pediatrics because I'm going to be delivering kids, so there's some aspects of pediatrics that I need to know to make me a better OBGYN. And surgery, because OBGYN is a surgical specialty, so you have to rotate to surgery. Also have to do some social responsibility, like go out in the community and, how to handle social settings. So the first year internship is what we call a rotational year. And then second, third, and fourth year, you're totally focused on OBGYN. The patients that we would see would be primarily service patients, meaning patients that do not have a private physician, that would come to the hospital, and the hospital has clinics for those patients, and those patients will be assigned to us. We follow them, obviously with supervision of an attending, a physician in OBGYN that has already finished and is supervising the residency and teaching us. And also, we would be responsible for private doctors' patients. For example, if a private physician has a patient that comes in labor, we would be doing the screening, like the evaluation, and then report to that private physician. So it's a combination. And that I liked St. Luke's Roosevelt because of that, because it had a good ratio between private patients and service patients, so that I can experience both. When I trained, when I did my residency, there was no law, in terms of how long the physician could work continuously. Since then, now there are regulations. But I distinctly remember walking into the hospital on Friday morning, and if you were on call the weekend, you would not get home until Monday night. Okay, and that no longer happens now. There are specific regulations about how long you can continuously be working, but the hours were very, 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 very challenging. I remember Dr. Chamsey. He was the head of OB. And he was excellent. I liked his style of teaching. He was very hands-on. I liked that. For example, he would teach you something and then he'd want you to experience it. He'd want you to do it, He was a great teacher, but very compassionate, very patient with the residents. And I remember having a good rapport with him. As a matter of fact, he ended up being my own physician and delivered my first child. Graduating from medical school, you're still a student. So I think that it's a big step, you're becoming a doctor. So that was a big step and it's a big celebration. From residency, you're more mature. You're already a practicing physician, really, because you are working as a doctor. It was more of a social event rather than an academic event. That's what I recall. Right out of residency, I opened up private practice. My first office was on 96th Street and Amsterdam Avenue. I remember in my last 6 months of residency, seeking out different offices in the area. And someone pointed out that an internal medicine doctor had space. And I went and interviewed with him, and he said that he would have me. And most of my patients initially came referrals from him. And I developed a network of physicians through an organization at the time that was called the Dominican Medical Society. And I befriended many of those internists, and they would refer patients to me. It's all relative. Doctors make a lot of money, but it costs a lot to become a doctor. It costs a lot to become a doctor in terms of finances and in terms of commitment and in terms of time. A lot of sacrifice. So everything, everything is balanced. The patient is number one. Do no harm, meaning it's the number one priority. So finances should not be the number one priority. It should be the patient first. And I think in general, doctors do that. Some people, make ridiculous decisions and and stray from that, but that is the basic rule of being a physician. I guess I was fortunate in the sense that I chose a specialty that has always been very prosperous. So I was lucky in that. And it didn't matter whether, whether I worked in Washington Heights or I worked in Midtown or wherever I worked, obstetrics and gynecology has always been very lucrative. Within the first 2 years of being in private practice, I already saw that I could purchase a home. We purchased a vacation home an hour away just for weekends, a lake home. And within a few years after that, we were building our home. It just happened. It's not something that I planned, There's certain rules, You have income and you put some away, you use some, and you give some, That's the basic rule. And obviously, the more you have, the more you can save, the more you can spend, the more you can give. My very first delivery was as a student. As a student, with supervision, you can do a delivery. Well, I've had tough situations, but nothing that I would lose a patient or a child. Now, I do recall, like in the middle of my career, one of my patients had what we call an abruptio placenta, where at home, placenta separated. And I remember she called me with severe abdominal pain, and I told her, we got to go right in. By the time she got into the hospital, the baby had, died because of that. So I was on 96th Street probably for about 3 years. And then I obtained my own space and my own office. I bought my own office on 77th Street between Central Park West and Columbus Avenue. So we renovated that office and opened there and was there up until 10 years ago. I'm very patient. That's one of the things that I can be proud about. Any physician does not like poor compliant patient because that leads to problems. If you tell a patient you need a mammogram or you need an exam every year and they don't come back for 3, then, where's the prevention? That's the problem. Then you discover the problem when it's too late. Another one that I might say, I don't know that I would call it pet peeve, but lateness. When patients don't come to their appointment on time, that causes a problem, because then you're either not seeing patients or you're seeing more patients than you can handle at the same time. We usually try to accommodate the patient, but it creates problems in the sense that then you're backlogged and then you're not seeing patients timely. It's something that you learn as you're in practice. That's part of the private practice or the practice setting. You learn that as you go. One of the things that we do, we try to call patients ahead of time to remind them of their appointment. And that way we have a better idea of whether they are going to come or not going to come. I recall during my busy private practice of obstetrics that there were times that we may not be able to see the patient, And but in general, we try. We try to accommodate. I had my fiancé, Rafael was my husband. We courted for about 8 years. And we started dating in high school. We met locally. We met in the community. I remember he played tennis. I saw this young man with tennis shorts and a tennis racket. And I found that very attractive because none of the other boys in that area played tennis. They played basketball, so I became curious about that sport. And that's how we started to court. He went to Brandeis High School, which was local as well. He wanted to be an engineer, so he went to Brooklyn Polytech Institute, which was an engineering college at the time. And then subsequently went to the Navy while I was in medical school. As a matter of fact, there's a big joke in my house because he came 3 or 4 times before my father would even open the door, give him the light of day. My mother was so embarrassed. He goes, oh, please, he's come so many times, just say hello. And finally, my father came out and said, I'm going to tell you one thing. I will allow you to be here only if you give me your word that you understand that she is going to be a doctor and she cannot get married. She cannot do anything until she has that title. I graduated from medical school today and I got married a week later. So I start my residency already married, but my first child arrives at the end of my third year in residency. So we waited about 3 years before we had children. My first child is Oscar, and he was the only child for 7 years because then career starts. It was difficult to balance more than one child. There was no doubt about that. And then when Oscar is 7, my second child arrives, and that's Ruben. So it's like having a newborn again because Oscar's already a grown kid. And then Yvonne, my third child, arrives 2 years later. Well, my parents were already back in Dominican Republic. They were not here all the time. They would come frequently, but they were not with me at all times. But from the very beginning, I had to have a sitter. I had to have a living. At first, it was my aunt who helped me. Tia Lelea helped me. She was my mom's sister. And then when Oscar, my older son, was 3, Dulce was my babysitter. And Dulce is still with me. She helped me raise my 3 kids. And now she helps me with my mom. So she's family, you know. Being an OBGYN, I needed to have somebody living in because at any moment, in private practice, at any moment, someone could call you. You have to go into the hospital and deliver a baby. You have to have someone staying home. That was always a very big challenge for me to work all those different hats. But, you know, you manage. Fortunately, I did have a lot of help. You know, you can't do everything alone. When you're doing it, when you're into it, you think you're doing the best you can. But I do remember when my older son, Oscar, was adolescent, or maybe early adolescent. I remember he wrote an essay in school, and it reflected the fact that he wished that I was home more. I do remember that. And, you know, when you're going through it, you think everything is under control. And like I said, my then husband, or the kid's father, was more hands-on. He was able to be there. His work permitted that. And I had help. Like I said, Dulce was with me. She's like a family member that when I wasn't home, she would pick up. But, you know, kids always want their mom. It's a difficult thing for women doctors. You know, you're torn. You know, you're torn between family, between being a spouse and your job. But we manage. It's busy from a professional standpoint, but the social life is basically vacation. They meet with friends. We were quite social. We had a lot of gatherings at the house. You know, family, friends. I credit the Dominican Medical Society because through that society, I was able to meet other Dominican doctors, which I did not know when I graduated from residency. Having gone to medical school in the United States, I didn't have that relationship with them because many of them graduated in Dominican Republic and practiced here. So that helped me a lot to get to know that group. And I became very active with that group to the point that I was treasurer twice and then vice president and then president of the organization. They respected me tremendously, you know, because the Dominican Medical Society had several duties. It was political, meaning making sure that the community was aware of the patients or the community's needs, but it was also social, you know, a way of getting all the doctors together. And it was also educational. We would run symposiums, medical symposiums, sometimes here in the United States, sometimes in Dominican Republic, to increase our knowledge base of the current, you know, topics at hand. I was a frequent speaker, so I gained quite a bit of respect from them. And that also served as a referral source. You know, we would you would refer patients to one another. Like if I had a patient that needed a ear, nose, and throat doctor, I would refer to that colleague or an endocrinologist, and it was wonderful. And we also socialized, obviously, through the society and outside of the society. You start developing friendships, and that was really important phase of my life, I would say. I think it's more education. I think it's making them aware and educating the public. I think that's very important. I remember doing lectures in the local schools to educate. And I remember having health fairs for the community, where we could, give them vaccines. We give lectures to the community to educate. I think that's where we had the biggest impact in the community. Well, I should also add that while I was in my first location on 77th Street, at some point in time, I also opened up a second location in Washington Heights, because 77th Street was not thought as a Dominican community, so not as many Dominicans in that area, and some would not want to travel down to that's considered Midtown, although you and I know that that's Upper Manhattan. But from Washington Heights, they consider that Midtown. So I opened up a second location in Washington Heights, and that was also very, very good, very successful. About 10 years ago, I decided that I didn't want to do more obstetrics. It was very challenging, and the stress of getting up in the middle of the night and having that responsibility was something that I did not want to have anymore. And I decided to stop obstetrics, but continue to do gynecology. It was about that same time that I met my present husband, and he's an internist, Cesar, and we decided to relocate and buy an office in Bayonne, New Jersey, and that's where I am now. Internist, most people see it as a general physician. But that has further training than a general physician in the areas of all internal organs, cardiology, pulmonology, all the different organs. Cesar's practice was always in New Jersey. After his residency, he did his residency in New York at Flower Fifth Hospital. But after that, he went to Hackensack. He's always been in New Jersey. So his population of patients have always been Latinos. But in New Jersey, there's a broader culture. So he has patients of all backgrounds, Puerto Ricans, South Americans. I would say a good number are Dominicans, but not all of them. I think you have to have certain qualities that are important. First of all, I think you have to be well-trained. I think I alluded to that earlier. I think you need to have that passion for that work. If you don't have passion, you can't do anything, okay? Yeah, it's just a job. You're just coming to work, and anyone can do that. But you have to have the passion for why you're doing it and that you want to help. I think being a good doctor requires you to want to help your patients, that you put your patients first, that you want their care first. I think one of my positives and one of the traits that I think I regard my success in the field of medicine is because I have a lot of empathy for my patient. I do relate with my patient. I've heard not such good things from patients about other doctors, that they're impatient, that they're not as empathetic, and that's important if you're going to be treating patients, to have that rapport with the patient, to be empathetic with them, be able to, when you make a diagnosis, be able to explain at a level that a patient can understand, not speak over them. I've heard different from other doctors, not all, but it concerns me when I hear that, because that's not the way it should be. it's extremely gratifying to be able to relieve anxiety when somebody comes in with some symptoms and they're thinking the worst, and you can comfort them and, let them know that it's not the worst. Doctors in my field as a gynecologist, we're everything. I mean, we have to be psychologists. So women come in, speak to us about their children, about their spouses, about everything. So being a doctor is a unique ability to be able to not only help people with their health, but also with everything else in their life. It requires you to stay updated in the medical field because I tell you, things have changed from the time that I graduated to now, and that required me to stay up to date. You're not a good doctor if you don't stay up to date, and that happens. Maintaining all your certification, did your boards. Some doctors don't do their boards. They just they finish being a doctor and they don't do their boards, and then that limits you. The boards are the certification that you receive after completing your specialty. And that board requires exam and clinical. And every 10 years that you have to repeat that. So to stay up to date. I focus tremendously on the area of prevention. That has always been a passion for me. It's not just treating the disease. Yes, I can do that. You come in with a symptom and you already have the symptoms, I can treat that. I can do the necessary tests and examination to treat that. But I am very passionate about prevention, meaning do the things that require you to prevent disease. And part of that has been shown to be your annual physical, your annual exam when you come for a pap smear that detects cervical cancer, or when you go for your breast exam and, at the appropriate age, do your mammogram. I don't see males, but males need to do their prostate exam. Certain age, after 50, you have to do your colonoscopy. I believe in that. I believe that when you do these preventative tests, you can pick up disease before it gets too late. And, in the pre-stage. And also taking care of themselves to avoid disease. For example, I've always been an advocate with my patients about not smoking, not using alcohol excessively. Things that have been shown to help decrease death and decrease some of the major heart disease risks. There are many things that we can do from a lifestyle perspective to improve our health and prevent disease. There are many. Exercise is one. Drinking the right water is important. Our body is 75% water. So if you put the right water in your body, then your body is going to function better, okay? Now, it's a mere fact that bottled water, soda, tap water is very acidic in nature. You test it, the pH, and it's going to be acidic. Now, acidic is not the way your cells are supposed to function. Your cells are supposed to function a little bit alkaline. So if you give it the right water, your body's going to function better. So I am an advocate of alkaline antioxidant water. This water is also very super antioxidant. Now, everything you've heard about antioxidant is that it's helpful for chronic disease. Because every chronic disease, including heart disease, arthritis, any aches and pain you have, it's a chronic disease caused by inflammation. So everything we've learned that causes inflammation will be helped with this water because it's an anti-inflammatory product, and we can test it. You test it and you see that the inflammation factor is much lower. It's an antioxidant, basically. When I met my present husband, Cesar, we moved to Bayonne, New Jersey, and opened office together. At that point, I was practicing gynecology only, not obstetrics, and I started a practice in weight loss. So weight loss and aesthetics. So I would, do all the aesthetic treatments, Botox, Juvederm, all the fillers, and help people with their weight issues. I think as a Latino physician, I think things have gotten better for us. I think there are more of us. We are more clear of our goals and what we need to do in our communities. I think that part is better. But that being said, that doesn't mean that the issues of the Latino community as a whole are any better. There's still a lot of, there are some people that are just plain racist, and that still exists. But in general, I would say that it has been better for the physician group. I have patients from all cultures. It's not just Latino. I have, as a matter of fact, when I was on 77th Street, that's considered, middle class. And most of my patients, that's exactly why I started another office in Washington Heights, because I wanted increased volume of specifically Dominican patients. But on 77th Street, it wasn't mostly Dominican. It was mostly whites. I had a lot of professionals of all cultures from the hospital as patients, the nurses, the doctors themselves, the technicians that would come see me as patients. So basically, my practice is a very mixed practice. I think that's very, very important. And that's why I've made it my life experience to reach out to the community and lecture and give talks and health fairs throughout the years. Less health fair recently, but that education is key, because when you educate, you empower. Being interested in innovation. I've not been afraid to do something new. The fear is there, but I don't let the fear stop me. For example, to come to another state and to engage in a completely different field, not everyone does that. And I obviously have to do retraining. Finances are involved. Fortunately, it was there. And the commitment. I'm a hard worker. And when I see something, like I said, in life, you have to have a purpose. You have to have a dream. If you don't have that, you're not going to go anywhere. That dream is so important, because there are going to be times that are going to be tough. There are going to be people that are going to tell you you can't do it. But if you have that very clear in your heart and in your mind, you will do it. I've come to understand that when you're going to create something, you have to create it twice. First, you have to create it in your mind, and then you have to create it in form. So it's not just saying, I'm going to do that. You have to really feel it. You have to really work at it. You have to really believe it before you can create. What I would say is get a mentor. I believe in getting a mentor, because if I want to be an artist, I want to get close to an artist that has made it. So a mentor is someone that is in medicine, so that you can get information and get motivated. Very important to get a mentor. Speak to someone that has done it, so that you can be more motivated to get it done. That's one thing. And understand that it's hard work. Don't take it lightly. It's hard work. If you're willing to put the time, you can do it. Don't let anyone tell you otherwise. If you know in your heart, like I said, put it in your heart. If it's there, you go for it. In the past years, we're more conscious of practicing defensive medicine, meaning we want to make sure that the patient, we don't miss anything. So maybe more tests are done because of that. I don't think we as physicians worry about so much that there's a financial benefit to us. I think it's more practicing defensive medicine to make sure that we don't miss anything and prevent any bad outcomes for the patient. For example, if a patient comes in with a headache and in your mind, you think it's probably just stress. It's probably just stress. But because you're not sure, maybe some of the symptoms are there, you're going to go ahead and ask the patient to go see a neurologist. Or you're going to order a CAT scan just to make sure that this headache is not from a tumor in the head. Well, let me tell you, that aspect of medicine has changed tremendously over the years. There is a lot more over control by the insurance companies telling us what we can do, what we should do, how much to charge, and that is difficult. You know, what tests they require. It's a bit difficult, but we've had to adapt. In the past, definitely there was more freedom for the physician. The insurance had a lot more freedom. Now there's more managed care, so the insurances have guidelines as to what we can do. For example, Medicare for elderly patients. In the past, we were able to do pap smears once a year. Now they've regulated it to be every 3 years. And some patients are not happy with that because for years we spent time letting them know that the pap smear is important in terms of preventing and detecting cervical cancer. And now we're going to come and we're going to tell them that they don't need it that frequently. Some patients are not happy about that. So it takes explanation, it takes time to be able to explain to patients and determine which patient may be at higher risk than another. And I think it's cost, trying to cut back on cost, and it's risk, They feel that it's not risk productive, that it's not cost effective to do a pap smear every year on everyone. So that's why, everything has to do with dollars and cents, And we, the physicians, have to be more savvy about making sure that, yes, we practice the right medicine, but we also don't want to put our patients at higher risk. Things have changed. Private practice has become very challenging because of all the bureaucracy, okay? So today, somebody starting private practice on their own requires a lot more financial outlay than it did when I started. The common scenario, the common practice today is to work in a private practice group, salary, earn enough so that if you decide to go on your own, then you can do that. But it's very rare today to see someone go out and become a private practitioner. It was not so common then either, but I did it. It was more common than now, though. That's a lot, there's a lot. And how do you get your patients? Today is not so easy. Today, the model is more of an HMO model. So the insurance has a certain number of patients and you have to acquire those patients. It's not, in the past when I started, there was no HMO. It was all private practice and, private patients pay you privately or having private insurance that would pay you directly, not in an HMO situation. So it's different. If I was starting today, I don't know that I would start as a private practitioner because it's more difficult financially and structurally. I don't know that I would do that. Well, the pharmaceutical industry definitely has had a big impact on the health because, yes, they do control a lot of the studies. There's no secret about that. But at the same time, there are very good researchers, very honest researchers that are going to, and they receive grant for the research, that are going to do it and they're going to show the evidence in a clear way. So we're fortunate for that. But always keep in mind that when a research is being done on a drug, somebody has interest in that. Always we have to keep that in mind. Now, drugs are fine. I mean, we need them. In this point in our culture, in this point in time, we have an increased mortality rate because of many drugs that can keep us, alive longer. But at the same time, yes, they do have side effects. So if you can avoid the disease so that you don't need the drug, I'm more for that. I graduated from high school with a degree as a licensed practical nurse. I graduated from college, Queens College, with a degree in pre-med biology. That's a BS, Bachelor of Science. I graduated from Dartmouth Medical School within 3 years. as opposed to 4, with a degree in medical doctor. And I graduated from St. Luke's Roosevelt with a degree in specialty of obstetrics and gynecology after 4 years of training. I'm proud of many, if not most, I would say. I don't think I have too many regrets, but I hold very dear to my heart the work we did with the Dominican Medical Society. Not for pay, just work that we did for our community. I hold that very dear. Not only because of what we did for the community, which was very important, but also because of the relationships that I developed with the medical doctors. As I mentioned earlier, many of them Dominican. Not all of them were Dominican, because there were some that were non-Dominican but graduated from Dominican Medical School. So I developed relationships with them that I would not have because I didn't study with them, but I got to know them and I got to work with them, and we got to corroborate and do many, many great things together. I hold that very dear. I would say another accomplishment is when I became director of the department at Columbia Presbyterian Community Hospital, the Allen Pavilion. I'm proud of that, not so much because of what it was, but because I didn't think I could do it originally. I'm more of a clinician. I'm more of a one-to-one patient contact, and that required a lot of administrative work, and I didn't think I could do it. But I'm proud of it because I did do it while I was there. It was a short period. It was only 5 years, because I realized that that's not something that was for me. But I'm proud that I did it. At first, I didn't think I could do it. I was a bit scared, but I did it, and that's what it's all about. You grow, whenever you go out of your comfort zone a little bit, it gives you the opportunity to grow. If you stay doing the same thing all the time, there's no growth there. So I'm proud that I did that. I would say my whole life I'm proud of. I'm just proud of my whole life. The relationships I developed, the adjustments I've made in my life. I went through a divorce, and how I bounced from that. I feel very proud of that. For many years, I was by myself, trying to find myself and trying to understand what happened there. And to be able to bounce back from that in such a powerful way, I'm very proud of that. Met my new husband, and it couldn't have been a better fit. I think the field is wide open now, not only in the medical field, but in general. Latinas have the opportunity to do whatever they want. In politics, in business, in medicine, there should be no limits. I think we were the trailblazers, we got it going. So there's more opportunity now, I think. It's just a matter of grabbing it. When I was first asked to do this documentary about my life, I have to admit that I was a bit uncomfortable with that idea. First, I was uncomfortable about exposing my story and all my memories. I also did not like the idea that all the focus was going to be on me. That aspect was not very comfortable to me, because I'm actually a very private person. But I then realized that if my story could encourage even one student out there that could hear this message, I felt that it was worth it to expose myself and be a little bit uncomfortable. This is the reason that I decided to move forward and do the documentary.
Eran las 5 de la mañana seminarista, un obrero, con mis papeles de solvencia, que no le dan para ser sinceros. Eran las 7 de la mañana, y uno por uno al matadero. Cada cual tiene su precio, buscando visa para un sueño. ¿Cómo? El sol quemándoles la entraña, un formulario de consuelo, con una foto 2x4 que se derrite en el silencio. Eran las 9 de la mañana, Santo Domingo 8 de enero. Con la paciencia que se acaba tu pues ya no hay visa para un sueño. No, 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 no. ¿Cómo es el coro? Todo el mundo. Buscando visa para un